So you have a nagging headache that you may be worried about and are wondering whether you should seek medical advice. Well, stay tuned and I will tell you all you need to know. Hi, I'm Dr. Steve from AskDrSteve.com. I'm a registered GP working in London. I will answer your healthcare and medical questions. We've all had annoying headaches at some time in our lives, but thankfully most headaches don't have any serious underlying causes. You generally don't have to worry if your headache is occasional, mild, doesn't last for long, or has a cause you can identify, such as a hangover, lack of sleep, a flu-like illness, sinus infection, or you've not been eating. I will talk about some situations, however, where you should seek medical advice. I will divide these situations into 3 categories. These are seeing your GP, calling 111 to ask for advice, and finally going to A&E or calling 999. So let's talk about when you should see your GP. Your headache is different from usual. Whether that means it's happening more often, is more painful, or a different type of pain, it's worth getting this investigated. Your headache is not getting better and maybe even getting worse when using over-the-counter medication. You may have what's called a medication overuse headache. You have a headache with exertion, for example sexual intercourse or exercise. You have a shooting pain at the front or side of your head. This could be a migraine or cluster headache. You should talk to your GP about how best to manage it. Your headache is worse if you lie down, cough or strain. Standing may improve it. This could be a sign of raised pressure within your head. Some people experience this as a morning headache. You have a persistent headache and are pregnant. These are usually just migraine or tension type headaches. We would, however, like to rule out other conditions such as preeclampsia or venous sinus thrombosis, which is basically a clot in one of the veins inside your head. You have a headache with nausea and vomiting that's not related to alcohol, influenza or tummy bugs. You find light or noise painful. You have a persistent headache and your immune system is not working so well as a result of medications such as steroids, chemotherapy or illnesses such as HIV. You are more susceptible to infections in these situations. If your headache causes you distress and you would like to find out how it could be better treated, then we would like to hear from you also. Calling 111 in the UK. You should do this if you have a headache and your scalp feels painful or sore, your jaw hurts when eating, or you have blurred or double vision. One of the conditions that we would want to rule out would be something called temporal arteritis. This is really just a fancy name for swelling of a blood vessel on the side of your head and behind your eyes. Going to A&E or calling 999. You've had a severe head injury. This may be from a fall or an accident such as a car crash. You have a sudden headache that gets much worse within a few minutes. Some people may describe it as the worst headache of their life and even like being hit around the head with a baseball bat. We would want to rule out a bleed inside your head in this situation. You're having a headache, but you're also experiencing fits. You have a headache with a high temperature, feel hot or shivery, and have a stiff neck or rash. We would want to rule out meningitis or a brain infection. Feeling drowsy and confused can be part of this, as can vomiting. You suddenly have problems speaking or remembering things, weakness or numbness to one side of your body, visual loss or balance problems. These symptoms could mean that you've had a stroke. The white part of your eye is red, This could be caused by a condition called glaucoma, which is raised pressure within your eyes. Finally and importantly, as always, if you're not sure about anything or are worried, then please seek medical advice. You can call 111 at any time of the day or night. I hope you found this information useful, and I do wish you a speedy recovery from your headache. If you would like more videos on healthcare, then please subscribe to my channel Ask Dr. Steve and visit my website askdrsteve.com. Thank you.